My name is Khadija. I'm 19 years old. I come from Darajambili, Kisii County. When nilienda kutest HIV, I was so anxious. Like, I was so stressed up. Doc aliniuliza, kwanza niliingia niliuliza nimekuja kufanya nini, like nimekuja check up gani? Kaambia nimekuja HIV testing. So, kama na test kit, akanidunga kidole, akatoa some blood sample, akaiweka kwa ile kit. Akaniambia kuna lines mbili. Kuna control line na kuna test line, and the procedure will take 15 minutes to 20. Nikamwambia sawa. Finally the results came, ilikuwa negative. So nikauliza doc, so how can I prevent myself? Akaniambia naweza use CD.
Homa Bay County, the key drivers for HIV infection among adolescents, one is early sexual debut for these adolescents and young people. And also we have sex for financial gain, where we mostly find intergenerational sex, and also unavailability of prevention services. Because if you check our prevalence, also new HIV infection among our 9 sub-counties, you realize that sub-counties that have higher prevalence of HIV infection are sub-counties that are geographically disadvantaged. They have difficult terrains and also accessibility of health services. It's a challenge for these adolescents and young people.
Adolescent and young women aged 15 to 24 years are 4 times likely to acquire HIV infections as compared to their male counterparts of the same age. Various inequalities make adolescent girls vulnerable to new HIV infection, such as lack of education, poverty, intergenerational relationships, and lack of access to comprehensive and youth-friendly sexual reproductive health and HIV information and services.
I got contact to Tiko from where I was working. I got it from a friend. Then she told me she will take me to the mobilizer who mobilized her to Tiko. So I went to the mobilizer. She asked me some few questions. She told me that she will take me to a clinic where I could get the services for free. I was struggling to get services like family planning.
In a case where we find uterus scam, to get prevention services like post-exposure prophylaxis or pre-exposure prophylaxis, first of all, we screen this youth to see if he or she is eligible for this service first.
If we have tested the adolescent and she is HIV positive, we start them on ART. We are giving out free to our facility.
We do counsel them and advise them on their adherence of this medication, because you can initiate the drug, but they maybe go lost to follow. Tiko itself has changed me as an individual in assisting these teenage girls, especially advising them, counseling them, and also even educating them on what they should, how they should keep themselves and conduct themselves such that they are not exposed to maybe HIV-related condition and STIs. And at the same time, I do advise them on how they can take care of themselves such that they are able to finish even school without maybe having that teenage pregnancy.
We have been able to train service providers on the change in algorithm for HIV testing, as the country is now doing a 3-tier HIV test through Tiko, supported by UNAIDS. We did a training for a class of 50. We also did a training for ART guidelines for a class of 35. So this is to capacity build these service providers to be able to respond to these adolescents and young people timely and also effectively.
What keeps me motivated is the friendship that we have created with our clients. How is this friendship has come is we offer these friendly services in a private manner. That is like when we do these services like testing services of HIV and AIDS, that information is confidential between the healthcare worker and the youth.
In collaboration with other responders, we are seeing HIV prevalence has gone down. Even deaths which were related with HIV has gone down from in 2017 at 14,000 to 1,409 in 2023. So it's showing that these efforts are giving us positive results that we can talk about as a county, and we would really love us to continue this implementation.
UNAIDS will continue supporting the HIV prevention and treatment services among adolescent and young people through technical assistance and advocacy for adolescents-friendly, person-centered services without stigma and discrimination.
HIV is not end of life. Yeah, mtu anaweza prosper, unaweza soma, utapata umewaka hata like outside the continent you are living in. So mi sioni kama like HIV ni barrier kwa mtu kusucceed ama kwa mtoto msichana kusucceed.